liaison to the ASA Safety Committee. I want to thank you all for joining us. And today, I'd like to introduce briefly our panelists, as you can see on your screen. I'd like to thank them for joining us and helping us to better understand what we may be able to do from a safety perspective in protecting our workers. Thanks to Greg Holbrook, Vice President of Shared Services, and the panelists. Feel free to shake your hand or wave as I introduce you. Tracy Spunenberg, and Tracy, I love your title. Tracy is the Chief Person Officer at the Granite Group, and also Brittany Cornelaud. And Brittany, I apologize if I pronounced your name wrong. I'm always used to calling you
Everybody does it.
Did I get it right?
No, but no one does.
And how do you pronounce it?
Corneo. So it's a French monstrosity. If you think about, everyone has a cornea in your eye, but just put an O at the end of that instead.
Corneo. So everybody, this is Brittany Corneo, staff attorney with First Supply. So, you know, there has been a lot of excellent information out there coming our way during this pandemic, covering areas such as leadership, remote working, the economic impact of the pandemic, the emotional impact of the pandemic. But as the ASA Safety Committee was talking about the things that they may be able to do in relationship to providing help to our members, they said, you know, there's not a lot of conversation out there about what people are doing to help protect their workers in the workplace. So that's what we decided to do and thought that would be a good thing to do. And as you all know, that the PHCP and the PVF supply chain is considered from the federal level to be an essential supply chain in what we're doing, and also considered an essential supply chain at a lot of the states throughout the country. So because of that, our workers, and those workers who have jobs where they just simply cannot work at home, are working in the workplace. So that's what we're going to try to do today, is talk about what some of our members and the panelists will be talking about what they've been doing in that area. You know, I recently discovered the acronym, and I'm probably behind the times on this, but I recently discovered the acronym VUCA. And if you're not familiar with it, it stands for, I'm having a little technical difficulty here. I don't know why. Just a minute. It stands for volatility, uncertainty, complexity, and ambiguity. So that's the acronym VUCA. And I thought to myself, and I think we all can agree that that is what we are living daily right now, right? This in a VUCA environment. I think another thing that we can all agree on is we are just trying to keep up with all the information that comes out daily related to the pandemic, advice coming from both the federal and state agencies responsible for public health and safety, and just we're being inundated with new and different ways and how the virus is transferred from one person to another and all that. So we're all just trying to keep up. And finally, I think we can all agree that none of us are experts, but we can all learn from each other. We can all talk about together what we're doing, lessons learned, and all that. So our goal today is, that's exactly what we're going to do. We are going to, our panelists will be talking about what they have instituted in their environment, in their workplace. And what we also want to make sure happens is that we hear from you, the participant. So we're asking that during the discussions and as the panelists begin, we're asking you as participants to enter any questions or comments you may have into the chat box. If you think as a panelist are talking and you have an idea about letting other people know what maybe you've done in that given situation, whatever, go ahead and enter it. I'll be watching the chat box and I'll be bringing in your questions and comments into the discussion throughout the webinar. So we need you to participate in this so we can all learn from each other in addition to the panelists. So the final thing I want to say before I turn it over to the panelists is What we don't want to do today and what we aren't doing today is providing legal advice or legal counsel. As we get into these discussions, I understand, and we all understand, that there probably will be questions that have a legal impact or a legal connotation to them. The message we want to give to you is, as you develop or as you improve or as you change practices and policies related to safety in the workplace and COVID-19, is to always check with your legal counsel and get legal advice. Today, we are not providing that for you. So with that said, I'm going to now be quiet and I'm going to turn it over to the panelists and ask Greg. Greg, you can go first, and the floor is yours.
Sure, thanks, Jim. Good morning, everyone. I'm Greg Holbrook, Vice President Shared Services at Wind Supply. Jim asked us to provide a little bit about ourselves and our company, so I'm going to do that first. I've been at Wind Supply since 2010. First serving on the internal audit team, and then later taking over as Vice President Shared Services at Wind Supply, which is a collection of services that help with back office functions at the headquarter level. So Wind Supply is a collection of approximately 600 locations, and we operate in about 45 states. Each of our locations, or local companies as we refer to them, is an individual C Corp made up of a partnership between local owners, which we classify as entrepreneurs, and Wind Supply as the majority owner. These local owners have a high degree of autonomy and decision-making capabilities, including how they serve their customers and products they sell. Wind Supply provides each of these locals support services such as payroll, IT, training, marketing, and others, so they may focus their time on serving their customers. The local companies are governed by a board of directors made up of the local company and members of the Wind Supply Inc. team. And so that's a little bit about who we are, and our structure is a lot different than other organizations. But, as we battle this COVID-19, there's a high degree of uncertainty. What we do know is what is being publicized and things like that. And so our focus has been to do the right thing for not only our employees, our customers, and our vendors, but, everybody in the community as well. And the biggest thing that we did as an organization, we're very fortunate to be headquartered in Ohio, and Governor DeWine issued a lot of statements and restrictions early on that allowed us an early opportunity to adapt to the environment that we were going to see across the United States. And what we did was, as a team, we assembled many task forces internally. We looked at the CDC guidelines, we looked at OSHA compliance, which is the main reason we're talking today on the safety side, as well as, every other partner that we have, from legal and compliance side to just our vendor partners in general. And what we did internally was try to get ahead of the prevention. And so we developed a list of approximately 6 or 7 procedures that kind of guide what happens in certain situations, from preventative measures, which we kind of do the code green, yellow, and red, the prevention, someone showing symptoms versus someone actually has been in one of our local companies and been diagnosed or confirmed with the illness. What we are doing in these cases on the preventive side, obviously we're doing the deep cleans and things like that, using proper PPE. One thing that we also instituted is someone showing a sign, we instituted, what'll happen in that and how that deep clean process works. And then, we've even gone as far as, and in certain situations, we've had a few instances where we actually had to temporarily halt business at some of our locations for a few days so we can do deep cleans, because either someone inside the company or someone brought in, was diagnosed and we were notified. One thing that I will also say is one thing we've done to stay ahead of it to protect our employees, our customers, and the like is electronic authorization to drop off materials at job sites. And so one thing that we've done more recently was most of our locations are pick up by call, so that we're not having a lot of foot traffic in our companies. We do a lot of deliveries and direct ships. And for those companies that we make deliveries, we don't want to be handling the paper and the other items. So we actually have authorization forms that we've developed in concert with our team and legal counsel to allow us to drop materials and not physically have to get a signature on site as proof of delivery. Other things that we're doing internally as far as task forces is not only to keep our employees abreast of all the information that comes to light, but also sharing, with the community and trying to be as proactive and as upfront about this as we possibly can. In the state of Ohio, the Governor DeWine has asked anyone that's essential and go into the location to take people's temperatures, and that would have been forbidden in the past by HIPAA guidelines. But you're seeing some laxation of certain rules and focus on what is the right thing for not only employees, customers, and vendors, but how do we move forward in this environment altogether? This is a pandemic that we're all facing together. So even though that the other panelists and Wind Supply may be in competition, we're all fighting the same battle together. And so anything that we can do to provide information or share, we're willing to do that and hope to make the most of this. Thank you.
Hey, Greg, I'm curious, did you have, when you look at the OSHA guidelines, the first thing they talk about is the need to develop an overall infectious control plan. Did you have a plan in place prior to COVID-19, or did you basically, as this pandemic started to roll out, that you basically were starting from scratch? So I'm curious if you had something in place already.
Yeah, we have a lot of plans in BCP and things as it relates to planning for events like this. I cannot say for certainty that we had a infectious disease plan, but just as anything else, any plans you have to be adaptable, right? And so we've had to adapt as an organization and facing what the COVID-19 is bringing, because at the onset of this, in this country, we really didn't know what we were going to expect. And so there's a lot of things that were unknowns. But what I will say for that, we've had many events in our past that have prepared us for our present day at Wind Supply.
Are there any specific practices you've instituted as far as the social distancing within the workplace?
What we're trying to do is more or less limit. So we do social distancing when it comes to employees, and we educate. And so with the way Wind Supply is set up, it's not a top-down organization. So there's a lot of things that we just can't push down. We rely on our local owners to make the best decisions that are feasible for their market. And that's how we react very quickly as an organization. But what we do is educate on, hey, what are those preventative measures? What are the things we're seeing? What are the things we can do better at? Which kind of led to the electronic proof of deliveries, right? We don't have as much foot traffic. We don't want the foot traffic in our companies. We want to make those deliveries. We want to not only protect our customers, but protect our employees. And so it's really about the safety and wellness of all parties involved in the transaction, right? And so the more we can limit exposure, the more social distancing plays a part in what we're just practicing day in and day out.
I was wondering, you used the term deep clean. Can you talk a little bit more about that and what that means?
Sure. Deep clean would be a situation where you utilize the PPE and equipment that you have, and you actually go through and thoroughly wipe the counters, mop the floors, put disinfectant down, be more orderly, clean the warehouse. And, if there is a situation where you're aware of someone showing symptoms or a customer being in the, whether it's at the front counter, we hope not in the warehouse, right? But you just take extra care and duty of caution, duty of care in those areas. Again, the deep clean is a term we use just to say, hey, go above and beyond, do more than what you've always done, and be extra careful, because there's so many unknowns about this that we don't want anybody to be at risk. And, in the state of Ohio, what I read yesterday was, this illness or disease, whatever we want to call it, has, hit the ages of 1 to the age of 99 with a median age of around 53. So, I mean, there's nobody that's not susceptible to this.
Yeah, I think that's an important message. Again, we're learning every day something new about it. One last question for you. I'm curious about the process you put in place about people bringing in as you receive products and shipments coming to the facilities. On a very small scale, I'm just thinking about here at home when I get an Amazon box and my wife makes me put it in the back patio for for a certain amount of time to let it settle and all that, and before we get contaminated in the house. Are there any steps that you're taking as product and shipments are coming into the facilities related to making sure they're not bringing in potential contamination into the workplace?
Again, we don't push any edicts down because, we have that shared ownership model in our organization, but, we push out through education, right? Our best way to influence and affect decisions is education. And so the education would share with you, if you have the PPE and equipment, you wear the gloves if you're doing boxes and things like that. But you have to be very careful that, if you use the gloves on the box and then you use the gloves on the keyboard, if later on you don't have the gloves on, you go back to the keyboard, right? Did that really do you any good? And so you got to be very careful, wash your hands thoroughly, and take all the steps necessary when you do the deep cleans, not only, the warehouse and the floors, but also the computer equipment, because it's, one of those situations. The other day I was at a gas station and a guy used gloves to fill up his gas tank. And then he opened his door, got in his car with his gloves on, stepped back outside and lit up a cigarette. So I don't know how good that PPE was doing him at that time, but it made you think about it. If you can get the education awareness and share with what's going on, that's how people can do better, right? That's, you have to rely on, humans to make the choices that are in their best interest. And we just always want to push and be extra cautious, especially in times like these.
Yeah, I think that's the message that's coming out loud and clear is that a lot of this is up to us and the individuals, and no matter where we are. I'm constantly thinking about touching my face and all of that, and I realize just how much I do it. And so it's an interesting thing. So thanks, Greg, for giving us some insights into Win Supply and what you're doing. To the participants, I remind you, if you have any questions or comments, please enter them into the chat box, and I will pass them along to the panelists as we progress. And at this point, Tracy, I'm going to turn it over to you and let you speak a little bit about what's going on at the Granite Group and a little bit more about your company and you.
Sure. Thank you. My name is Tracy Spanenberg, and I'm the Chief People Officer of the Granite Group. And like you mentioned, it's an interesting title, Jim. It's the more modern equivalent of the Chief Human Resources Officer. So I usually liken it to it's the CFO for people. So it's it's the head of HR. So it's a fun title, but that's essentially what it means. So my job is to make sure the people at the Granite Group are happy, basically. I mean, there's many things involved in that, but that's my job, is to serve our people at the Granite Group. So if you're not familiar with the Granite Group, we're about a 600-person wholesaler. We're located in the Northeast. We're in every New England state. We have about 45 locations all over New England, and we're a wholesaler of plumbing, heating, cooling, water, and propane supplies. And in all of our states, we are considered an essential business. And what that means is a little bit different in every state. A state like Vermont, that is taking it a little bit more stringently than some of our other states. So with this pandemic, we've really seen it progress in many different directions over the past several weeks. But as of now, we're operating in all of our locations. That looks a little bit different in each location. Some of our locations are curbside only, which means that our customers can pull up. They have to call a number. We come out and bring them the items. Some of our locations are you can actually go in. But in all of our locations where you can go in, we've set up social distancing barriers. So our customers can't get more than 6 feet. They have to be at least 6 feet apart from our customers. So that has been an adjustment, but it's something that we certainly felt was necessary for the safety of our customers and for the safety of our people. And as far as safety goes, I can remember when we set this up, pretty early on, we set up a virus response group. And so that consists of me, our CEO, our CFO, our COO, and our chairman, and we get together literally every day. Right now it's via a Zoom call, and sometimes it's more than once a day. And we're responding to questions generally within 15 minutes that we get to that group. So early on, we developed an email, put that out. We gave my personal cell phone number, our CEO's personal cell phone number for people to call with any questions. And being my focus on the people, it's also on the business and the health of the business, but we don't have a business without our people. So it's really important through this process that we've communicated extensively. And so our CEO issues an email every day and a video every day to our people. And that's just what we're doing in the moment, because it changes literally daily. And we've tried to keep that constant line of communication open, and we hear a lot of great feedback from that. And certainly, you can have all the policies in the world, and you can have all the handbooks and procedures set up in the world, and then when something hits like this, you're not prepared. No one was prepared for this. Truly, nobody was prepared. And so we put an immediate focus on our people and communication and prioritizing people over policies, and we certainly have them, but we didn't dig into, okay, we have a pandemic, now what do we do? We just started to do the right thing immediately and then respond on the fly. And our chairman, Kevin Condren, he likes to say that, ideally you want to be proactive, but in a situation like this, you really are forced to be reactive because you have to pivot on the fly. So the virus response team, made up of the people who they are, can make decisions right away. So we're really relying on our team to tell us, like, hey, we need this, and what about this, and have you thought of that? And that we can listen to that and respond immediately. And that's really been a terrific help. And I think it's been, in a really uncertain time, some level of comfort for our team, knowing that, not only do they have some place to go with questions, but they can get answers pretty quickly and really have an impact. And we did early on, provide all of our locations with sanitizing kits. We partnered with our partners in our different locations. We cleaned them to make sure that they're doing extra cleaning. We did make sure that our teams who were cleaning in their own locations were taking necessary precautions. And then we're continuing to send out what's needed. And our HR team does things a little bit differently than I think we have in the past, in that we'll send toilet paper if somebody needs toilet paper, which has happened. We'll send sanitizer if someone needs sanitizer, which has happened. We just ordered a bunch of sanitizer from a local distillery because they're being kind of deployed to make hand sanitizer. So a lot of distilleries are making hand sanitizer now. So, and that's where we could get it from. So that's all of our locations will be getting, I think, some kind of whiskey bottles with some variant of hand sanitizer in them. But it works, and it's going to protect them in the event, particularly like our truck drivers who are out there and can't necessarily wash their hands all the time, and maybe touching something where they would need to. Aside from that, I think I talked, as you know, Jim, we had a person who tested positive in one of our locations. And again, you can have all the policies in the world, but we handled that the same way we're handling everything. We look at it immediately. We made the right decisions to the best of our ability and communicated. So I think within an hour, we had the building shut down. We had our people notified, and we had a statement out on our website, because the minute you tell your own people, you can't necessarily control that narrative in the public, and we wanted to control the narrative. He's doing well, wasn't hospitalized, and really we quarantined the people. We worked with the public health department. We hired an outside company to come in and do a COVID specific cleaning, and that worked really, really, really well. Not something you ever want to deal with. You really worry about the health of that individual and the health of everyone there and your customers. So there was a lot of communicating to our team, our customers, etc. So that was our first. We don't necessarily expect it to be our last. We certainly hope it will be, but we're taking necessary precautions. Anybody that sneezes within 1,000 miles of, of our locations almost, we're keeping them out of work. So we're being really, really aggressive with managing that and making sure people are compensated, making sure that they're staying home. We've offered varying levels of people being able to stay home. So we started with you know, kind of a just, hey, if you are more comfortable staying home, stay home. And then, and sort of being a little more strong about that, in that it's really okay if you feel uncomfortable coming to work. We'll work with you, and it's okay if you can't work from home and you feel like you need to stay home to take care of yourself or take care of your family. And we did go to remote work where it was possible and where people wanted to do it. And we got, again, increasingly stronger about that as well, to keep that continuity of the business and to keep people feeling like they could control where they wanted to work and how they wanted to work. So that's a deep download of the things that we've been doing here at the Granite Group.
Yeah, I'm wondering, Tracy, if maybe you can talk a little bit more about, you know, you had somebody come in specifically, I assume, knowledgeable in or understanding how to do a clean for COVID-19.
Mm-hmm.
Can you talk a little bit more about how you found that organization or that company, and how that went, or the process?
So we had right around that time, actually, it might have been within a day or two, had asked all of our regional directors, and we have 6 different regions, to make sure that they could partner with a company that did a deep clean. And that's just, you know, calling around, asking customers, doing Google searches, things like that. I asked a lot of my friends in the HR world, and then contacting them and making sure that they, their protocols as far as cleaning would meet the CDC guidelines for killing anything COVID related. And we did find a company. What we did find is costs varied incredibly widely. There are some companies that will do this, and it took a day and a half. So it is an extensive process. But there are some companies that do this and charge what they should be charging. And then there are some companies that are taking advantage of the situation. So it's really hard to figure that out. And the CDC does offer guidelines if there's been a positive test that you could do it yourself, but that's not a risk that we were willing to take under any circumstances. So they came in, I believe, in full hazmat gear, and they got rid of all paper. They deep cleaned everything in the building, and we felt really comfortable that our people could return when they were cleared to return, and they did.
Yeah, I think the other thing I found interesting was, and I think it doesn't automatically come to my mind, and so when you mentioned it, I wanted to reemphasize the truck drivers and providing them hand sanitizers. I think, you know, we got to think about those folks as well, who they're working, they may not be in the warehouse or what have you. So I thought that was good, and you know, so everybody, I think you would agree with me. I think the OSHA recommendation, maybe the CDC recommendation, is that you want something that's at least 60% alcohol based, if I remember correctly, on the hand sanitizer. Yep. So
if you can find it. If you can find it, and that's been the difficult part, at least here. Very difficult to find, and had we known ahead of time, we would have kind of saved some of our own stock. But I think we got depleted pretty early on.
Well, I think the other thing that came out, I think both Greg, from you and from you, Tracy, was I got the impression that both companies actually formed teams, or a team, or groups to really start attacking this. So I found that interesting. Can you, Tracy, you talked a little bit about, now you sort of described who was on your team. I was wondering if you can talk a little bit, either Greg or Tracy, and Brittany, you can jump in anytime as well, is that what was the thought process in selecting your teams, and who would serve on those teams to help develop the plans and deal with the crisis?
Yeah, I think our thought process was people who could make the decisions and make them quickly and get them out. So normally when we have some kind of committee, we like a good cross section of people from around the company in different jobs and and maybe even a slightly larger type of group, but that would just slow down the decisions. And so if we had a crisis like we did, if we got 4 or 5 people in the room who worked in this, who were at that C-suite level, we could make decisions much faster than if we had a broader group that had to go through a few different levels of approval. And again, normally that's not how we like to operate. That's not, but in this case, in these extraordinary circumstances, that was absolutely necessary.
Greg or Britt?
On our side,
any thoughts on that?
Oh, sorry. What I was going to say is on our side, we used all levels of the organization, and we used our vendor partners, HR partners, as well as legal counsel. It's one of those things that, as Tracy mentioned, there's a lot of companies out there that do it, and it requires some research and deep dives, and a lot of things that when we do take the steps to close a location, or I should say the local company board, those locations take that decision to close. It's generally for approximately 2 days. To allow for that cleaning process and those companies to come in, or however we had it set up. But it's really including multiple people because, again, we're not the decision makers at the top, right? We can't push that edict down. It's how those local company boards decide to operate. And so it's having a plan, it's giving people the information and being able to influence and share what's best for the person, right? Because we're all in this for the people. I mean, we really are. I mean, and we want to make sure everybody's safe at all times. So I just want to make sure that everyone understands that every plan could be different, but just include people you may not think about may be able to help and add value and be a great asset as part of these teams.
Is anybody else hearing that ping?
I am.
Okay, I'm just curious what I guess we'll see. I'm not sure.
I'm muted, so it wasn't. I know it wasn't on my end. It was on mute.
Okay.
That was my side either.
So Greg, you may be getting pinged. So anyway, as long as it is an alarm or maybe you have a new alarm, COVID-19 alarm that's going off. Let's hope not. So anyway.
It's going off every hour of every day, right?
That's
we're all getting a lot of phone calls, I bet you.
I hear you.
Day in and day.
I'm going to do a test here with the participants because I just want to make sure that the system's working. So if some of the participants can do me a favor and just enter into the chat room either hi Jim or what you're thinking so far of the presentation. I just want to make sure that I'm actually getting things that people are entering, because right now I haven't gotten anything, and I'd hate to find out at the end of the program that I had 20 comments that I didn't know existed. So if some of you can do me a favor and just say hi Jim or something, so I know that if you do enter something, I'll get it, that would be great. I wanted to ask Tracy, I had a question for you. You talked about sanitizing kits. Mm-hmm. What is in that kit when you use that term?
It was basically, we sourced what we could for cleaning agents that would kill coronavirus or any other viruses, and sent a jug of that along with a spray bottle and paper towels. So we have done that, I believe, twice so far. A lot of our locations already had stock, but a lot of them were running low. So that was something that we decided in the group. I think that actually came from a recommendation to our group from one of our team members. And so it wasn't anything fancy, but it was something that worked and could help.
Okay. I'm gonna bring up a topic for all three of you, and it's, I think every day in the news you get a different story, but I'm curious what all three of your companies are doing related to it, and that's the question of masks. Can you I'll start with you, Tracy, on what your company, do you have a policy related to masks or anything related to masks? I'd be curious to hear that.
Yeah, we just, it's funny, for the first time, I believe we just had the question come up today. We're still following, and this may change, but outside of a couple cities, as far as I know, the CDC is still not recommending them for healthy people, and they're generally used to protect someone from getting the virus, except in certainly healthcare settings, which that's used for general protection. So we don't hand them out. We certainly, if someone wants to use them, that's certainly fine, but we're not equipping all of our people with masks. And again, like anything, this could change. Right now, that would probably be difficult because they're very hard to get. And all of the recommendations that we've read were save them. We've donated some from some of our locations to hospitals. So all of the recommendations we read were to save them for healthcare workers because even they can't get them. So if that changes, we'll reevaluate our thinking.
Brittany or Greg, any thoughts from your end?
We don't have a mask policy. We really hammer home on this, maintaining the 6-foot social distance. So we really just keep people separated. And from what I've read about, not only is there a shortage and the critical need to be in the healthcare system, but also masks don't do much for healthy people other than remind you not to touch your face. So there is that benefit. But other than that, with the social distancing and the 6-foot distancing that we're really hammering home and the wash your hands signs everywhere in our facilities, we just haven't seen a need to take those masks away from the healthcare industry.
Greg, any thoughts?
We're pretty much the same. I mean, if anyone's out, they submit for unanimous action to allow individuals with compromised immune systems or those that have people at home to stay at home and still they want to pay them or do different things. So we try to say if you're not doing well, we want to make sure that within your well-being is what we're focused on. And I agree with Tracy and Brittany that it's that social distancing. It's keeping people from walking into the counters and things like that. It's trying to eliminate the necessary steps, because at the end of the day, there's nothing better than the social distancing, keeping that safe distance and just trying to limit the exposure that one can get. That many of our companies sell MRO, so that, they would be in the condition to sell the masks, and so it's one of those things. We don't take it lightly. We don't want to take away from healthcare, but we want to make sure our individuals are protected. And I myself, I haven't seen scientific proof that a mask is going to stop someone from getting it, such as what Brittany was kind of alluding to.
Yeah, there's a lot of misinformation, a lot of confusion, and we've tried to educate to the extent that we can. And the virus is hard to catch if you're doing the things that the CDC recommends: the hand washing, the social distancing, trying not to touch your face, which I've probably done 1,000 times already in this chat. But it is difficult to catch if you're doing the right things. And I think we look at our job as making sure that we're setting up our workplace and making sure that we're reminding people to do those things. And so in doing that, I think we're doing the best thing we can to keep people safe. And if our drivers go out, they're maintaining social distancing still, if they're doing that, and delivery certainly can be done safer if done properly than people coming into your counter. And our barriers certainly help out, but we're doing everything we can to educate and protect.
Brittany, you brought up something I was going to ask you all about as well as you were talking about masks. You brought up signs and hand washing signs. Have you, I'd like your thoughts as to all of you on related to signage, sort of that keep reminding the employees about things. How are you doing that? Where have you gotten your signage? What does it say? And Brittany, since you brought it up, I'll let you go first.
Sure. Our signs are handmade, nothing fancy over here, but they're printed out in color and put into a sheet protector, and they're posted over every sink. They're posted at random times in the hallways. They're posted at the reception desk. And I think it's a great reminder. I mean, I'm a big hand washer anyway, but the 20-second rule, I can't say that before all of this, I was washing my hands for 20 seconds and really diligently getting around my fingernail bed. But I sure am now. And the signs really trigger that in me. And so I do think they're helpful.
Yeah, it's funny, when I tried the 20-second rule, as this thing began, I told my wife, I go, boy, that's a long time.
Yeah.
And now I notice it's it's not as long as it was when I first started to do it, right? It becomes
Yep.
more. Greg
There's
and
all
Tracy.
these songs. There's all these songs you can sing, and we did the similar to Brittany. We had some handmade. We had some, I think, that came from the CDC, and certainly those are really, really helpful. And we tried to continue to message those. But one of the things that was really helpful for us was several weeks ago we had signs that were made up geared toward our customers, just saying no handshakes. You know, we're still going to greet you with a friendly smile, but we won't be shaking your hand. You know, we're maintaining social distancing and so forth. And I think now people really get that, but I think early on we did have some issues with some of our customers maybe not respecting that. And so pretty early on too, we asked our showroom customers to wear gloves when they were touching the products. And so we put some signage out for our customers as well, so that we could still continue to serve them in our normal, friendly, helpful way, just that looks a little bit different than it used to.
Interesting.
Yeah.
Greg, your thoughts?
Yeah, you know, we created and had signs posted internally that at the doors for customers that also explained if they were exhibiting symptoms that, you know, hey, we would like them not to enter the premises at that time. And so I think, as Tracy mentioned, at first you get that pushback, but again, you know, here in Ohio, we had to do that early on. And so from the first when this all started, I want to say it was around the 12th, you know, the whole headquarters has been remote, and we've been under mandatory work from home. And so the local companies are operating in the same premise. And so what we don't want is anyone to walk into the premises and have it and understand that you know, we can't accept that at that time. You know, we want to do business and we want to, you know, do everything just like everyone else, but we want to be good community stewards as well and protect the employees and the customers. And that's part of the reason that if and when we, you know, because likewise, we've shut some companies down for several days for the cleanings. You know, we want to make sure that nothing goes the other direction as well. So it's really, you know, the more information you can put and the honesty you can be with your customers later on, once this is all over, I think everyone will appreciate that, you know, what's happening, because commonly what we're hearing is we'll never know if we did too much, but we'll all know if we didn't do enough. And so it's that extra step, and we're all in it together. So
You can't over communicate in times like this.
Yeah.
You just can't over communicate.
All right, so I'm going to switch gears a little bit here. And by the way, I've heard from our Jen, who's actually behind the scenes coordinating this for us at ASA, that there's a lot of questions. For some reason, I'm not seeing my question box. And so she's working on that. But in the meantime, I want to sort of switch gears, but go to that next step. And Brittany, I'm going to ask you to focus on the question, what do you do if an employee shows symptoms or is exposed to or actually to the virus? How do you deal with that? And what is First Supply doing? So Brittany, can you sort of take us through that?
Sure, happy to. My name is Brittany Corneo. I'm the First Supply staff attorney. I am the sole member of the legal department. So I have my hands in a lot of things here, and I am on the First Supply Task Force. It's a 7-member group handling the COVID-19 response. I've been with the company since 2015. Before that, I was for 7 years in criminal law. So it was a 180-degree shift for me. But I'm been here for almost 5 years, getting to know the company extremely well. And this is by far the most exciting matter we've had to deal with in the 5 years I've been here. We're a privately held, family-owned company. We're on our 5th generation of Palings that have been owning the company. We are present in 6 states, all in the upper Midwest. We have about 650 employees and 38 facilities. So that's a little background on myself and First Supply. Like all of you, we've put together a lot of plans and policies rather quickly, and none of us are experts. but we are critical thinkers and we're motivated, and so we have put together some solid policies, and I'm here today to share the highlights of our response policy when someone, a customer or a visitor or an employee tests positive or shows symptoms or shares a household with someone who has tested positive or has symptoms. So there are those 3 sections to this policy, but they all have the same 8 general steps. And so I'll go through them now. The first is we made it clear in the policy that employees have a duty to notify their supervisor if they test positive, if someone in their household has tested positive, and if they or someone in their household has displayed symptoms, or if they notice a coworker or a customer who's displaying symptoms, they have a duty to notify their supervisor. So we've laid that out. The first step when we get the news, when the supervisor gets the news, is that we immediately and politely remove that person from the facility, or we isolate them into a room with a closed door. And we ask them to cover their mouth with a paper towel or a handkerchief or something to keep the respiratory droplets from spreading. Or they can isolate outside as they wait for their ride. But we try to get them off the property as soon as possible. That's priority number 1. The next step we do is we notify HR. We've designated a specific person to receive those notifications in the HR department, and we've given everybody that person's cell phone number, and they're ready to receive those calls. Confidentiality is key here. It's crucial that you do not use the name of the individual who's tested positive or displaying symptoms. Only if you absolutely have to do you use their name. Confidentiality is crucial. Next, we evacuate or section off the area that employee or customer has visited for more than 10 minutes within the last 72 hours. We also identify the equipment they may have used. If they work in the forklift, maybe they drive a specific, if they work in a warehouse rather, maybe they always use forklift number 3 or their RF gun 6 or something. We identify the equipment that they use and the areas that they've visited within for more than 10 minutes in the last 72 hours. And we cordon those off immediately. Then we clean. And we have a separate cleaning policy based on whether, again, the person's tested positive, displaying symptoms, or shares a household. And Tracy spoke earlier about the cleaning companies. We have a cleaning company on contract to do a CDC level deep clean should the need arise. And we've specified one specific employee who's the contact person for the entire company if anybody needs to have it deep cleaned. So each branch or each facility knows the name of that person and how to get a hold of that person if they need to invoke a deep clean. Then it comes to contact tracing. So employers have no duty to contact trace. That's the Department of Public Health's duty, is to identify the people and places that the infected person has visited. However, we can certainly help, and we can do that by compiling a list of people that the tested person had come into close contact with and in the last 2 weeks. And close contact, the CDC defines as spending 10 minutes or more within 6 feet. So that's close contact. Within the last 2 weeks, who have you spent more than 10 minutes with and have been within 6 feet of for more than 10 minutes? And then we compile that list of names and we have it ready for the public health department should it be needed. We have not had this happen. We haven't had to invoke this policy yet, so maybe I should have started with that. But we have appointed a specific person in the company to send notifications to those people, and we have a canned notification communication that will go to those people. Again, confidentiality is key. You cannot share the name of the tested individual under any circumstances unless that person gives written permission. And so we do have a canned written consent form for the person to sign if we feel we have to have their name for any reason, we have a canned permission slip essentially for them to sign. I don't think we'll need it, but we have it just in case. Then the policy includes some guidance on when the person can return to the facility. And of course, it depends on whether they've been tested, or not, and whether they themselves have symptoms or if they've just been in contact with someone with symptoms. So that section, the return to the facility section, has different forks depending on their level of exposure. One item that I am going to add to our policy after listening to today's chat is notifying our customers of the shutdown, not just customers that may have come into close contact with the tested individual, but just our customers who are looking to pick up product. We can't have the facility shut down for a day or two and not let people know what's going on with their orders. So I am going to enhance our policy to talk about how we're going to just notify our general customer base that this particular facility has shut down for how long. So I am going to add that to the policy. So thanks, Tracy, for sparking that in my notes. And then the policy includes just the general rule that we are not to give medical or legal advice to anyone. We want to help out. People are scared, they're concerned, they're confused. Information is coming from a million directions every day. And we want to help and we want to be clear, but we really have to toe that line that we can't give anyone legal advice and we can't give anyone medical advice. So instead, we're going to gear them to the CDC website. We're going to gear them to the local public health department website. We're going to gear them to their primary care physician, their health insurance policy. So try to help them identify the resources that can answer their questions without becoming the resource that answers the question. So that is the highlights of our policy. If I went too fast, I can certainly break down some of the nitty-gritty if you'd like.
No, it was excellent. And for the participants, Jen is actually emailing me questions because she's able to see questions. So I am getting them now through email. So one of the questions was, and Brittany, you may have talked about this when I was trying to figure out getting the comments or not, but I don't think either Tracy or Greg brought it up. But one of the questions is related to taking employees' temperatures. Is anybody doing that, and if you are, how are you doing that?
We are not. It is legal. The EEOC has relaxed its policies on that. It is legal during this pandemic. First Supply is not doing it, and there are a few points to consider if you are weighing the pros and cons of such a policy. The first is to protect the person who's in charge of taking the temperatures. It's difficult to take someone's temperature at more than 6 feet away. There is equipment out there that can test the temperature of physical equipment, lasers and such, but my understanding, and I'm certainly no expert, is that there's a degree of give or take. But when you're dealing with a human body, 1 degree matters. And so if you've got the equipment to test someone's temperature from more than 6 feet, great. But if you don't, you need to make sure that you're protecting the person who is taking those temperatures. You also need to, the confidentiality is crucial. So come up with a plan. If someone has a fever and you need to send them away, make sure the person is prepared and comfortable sending people away. That could get messy or heated. Make sure that you have a way to record who was sent away and why and when, and because they need then to stay away for a certain amount of days if they've got a fever. How are you going to record that and keep those records? If you're going to test employees, you should also be testing visitors. I haven't researched this too carefully, but you don't want to get into any discriminatory issues by only testing certain people. You should be testing everybody that comes into the facility, not just a select group. I'd be careful with that. So those are my thoughts. We are not taking temperatures, but I think I've heard Menards might be. So Menards is like a Home Depot up here in the Midwest. I don't know if you have them in other parts of the country, but it's like a Home Depot.
We aren't either in the cases where I know people who are using medical professionals or on-site medical professionals to do that, who can keep safe. And I'm sure there are some people who aren't, but that's at least the ones that I know of.
We're not either.
Okay. Before I start wrapping this up and closing this up, we've got about 5 minutes. I'm going to just open the door to the panelists. If you have any closing thoughts you'd like to give to the participants. Greg, I'll let you go first. We'll go in the order that you all spoke with. Any closing thoughts you'd like to share?
I think just, as Tracy mentioned too, we just have to over communicate. You can't communicate enough. And, our president of Winslow Inc. sends out communications daily, just like many others probably do. And the more you let your employees know that you care, the more that you show your customers that you care. I mean, we're all going to get through this. It's just, how can we make sure that the least amount of people that we come in contact with are, in the process. And just make sure, OSHA is very big on just policies and procedures in general. And, you can't create too many because you never know when another situation is going to pop up. It may not be this one, but it's what's next. And that's what we don't know. And, the National Association of Wholesalers predicted this year from many economists that there was going to be a disruption in wholesale distribution and the economy in general. But no one predicted this. And so it's just make sure that you have, you think about other things that can interrupt your business and how you plan for that, and start thinking about it now, because you never know when you're going to have to enact those plans or change or adapt. And it's how you shift, change, and adapt the quickest. That's how we're going to get through this.
Tracy and Brittany, I'm going to adjust the question a little bit for you, and also throw in, after you've just spent the time while Greg was talking to figure out what you're going to say, I'm going to shift the question, right? Is also to think about, is there one major lesson learned that you would like to pass along to everybody that related to what you did? And then Brittany, when it gets to be your turn, I'd like you to repeat that you mentioned about what is defined as close proximity, or I'd like you to repeat that, because I had never heard that before, and my guess is a lot of people would like to hear that again. So I'm going to ask you to repeat that. But Tracy, your thoughts, your closing thoughts?
Sure. I think when it comes to something like this, like we keep talking about, you cannot over communicate, but it's important for that to go both ways. So we've done just as much, if not more, of listening and opening up those lines of two-way communications and really walking that line. We're not doctors, we're not medical professionals, we're not mental health professionals, but we can offer those resources to people and we can listen. And in a crisis like this, it's really important to offer resources and to think not just about physical health, but about everyone's mental health, because everybody reacts differently to a situation, a pandemic like this. And I think, biggest lessons learned were, I knew we had wonderful people, I always knew that, but just how amazing and resilient and customer focused and team focused and our entire team across the company is really truly outstanding and astounding when you go through something like this and you see people really you see either the best or the worst in people, and we have definitely seen the best.
Brittany?
Yes. So close contact definition by the CDC is being within 6 feet of a person for more than 10 minutes. That's close contact. I think I made that way too complicated during my
No, that actually came up as a question, so that's why I wanted you to repeat that. And before you close us out here, I'd also like to, somebody has asked if they could get an example of, or if we could have available your actual policies that you walk through. Is that something?
Yeah, I have something in writing, but let me just run that by my task force before I send anything out. I can certainly share my notes on this.
All right. Any closing thoughts? And before you go, Brittany, Jen, I'm about to ask you to let me share the screen so I could show people some things on the website. So Jen, if you can share the screen to me, that'd be great. Go ahead,
So-
Brittany.
Just go ahead. Okay. So my closing thought is just to remind everyone that this is going to end. I hate reading about this being our new normal. This isn't normal. This is really strange. And it's temporary. It's not going to last forever, and we'll go back to normal. Now, after 9/11, it changed the way we fly, and security on airplanes and airplane protocol is much different. And so I expect things are going to be different after this and last, but it's not going to be like this all the time. We still fly, we still build tall buildings, and so this isn't forever. And one thing I've learned to do is limit my media intake. I've come up with a list of sources that I'm willing to read. And I have I have about 7 or 8 sources that I'm willing to read, and I check them at designated times every day, and that's it. And that's really helped keep my anger down, my disappointment down, but still get the information I need to keep First Supply moving forward and our workers safe.
Now, my wife will not let me listen to the news anymore as we're going to bed. But with that, I think and I hope everybody can now see my screen. And I wanted to just as a closing, direct everybody to some things that ASA has been working on the website. What you should see right now on the screen is an effort that the ASA Safety Committee has done in trying to pull together information related to workforce safety. A lot of what the panelists talked about is in this information, and maybe even getting a little more in detail, even down to what are approved sanitizers by the EPA for COVID-19 or the coronavirus, and even some legal considerations. So this is available to you on the safety page of the ASA website just by clicking on the safety tab. The other thing I wanted you to be aware of is that, oh, it didn't come out. I lost it for some reason. It's asking me for a login. I will tell you that what I was going to show you was an ASA University site we are offering for free to both members and non-members access to webinars and videos specifically related to COVID-19. So please, I encourage you to look into that. And if you have any questions, contact me on how to access it, or Jessica Thacker at Thacker@asa. or jthacker@asa.net, or Amy Black at ablack.asa.net. And they will get you the information on how to access it. The last thing I want to show you is the COVID-19 resource and information page we have put together. The ASA team has been working real hard in trying to gather everything and all things that were relevant to our industry related to COVID-19. So I ask you to look at that and look at it frequently, because we're constantly updating it. We just finished yesterday a town hall interview that you can see here with we've got Steve. I don't know if Steve's your boss, Greg, but he's with Wind Supply. We definitely have, I think, your boss, Tracy, Bill Condon from Granite, and our president of ASA, William Glockner, out in the West Coast, so with Hirsch Supply. So thanks to them, and there are just some great things on here. So I ask you to look at that routinely. So with that, I want to close it out. And Brittany, Tracy, Greg, thank you so much for the great information you provided us and the great insights. I think we all learned something, even we learned something from each other on this thing. So let's all stay in touch. Let's keep communicating, and everybody have a great day and stay healthy. Goodbye, everybody.
Bye. Thank you.
Bye. Thanks, Jim.